Thursday, June 27, 2019 meeting, North Andover Board of Health. It's 7:01 p.m. I'm Dr. Frank McMillan, Jr., Chair, and the meeting is now called to order. First item of business is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Speed pledge. Next item on the agenda is the approval of the minutes. The minutes have been previously distributed. Are there any corrections to the minutes?
They've been distributed, critiqued, and I make a motion that they approved.
Is there a second?
A second.
Moved and seconded. All in favor? Aye.
Aye.
Any
Aye.
opposed? The minutes are approved. The ayes have it. Next item is public hearings. There are no public hearings.
No public hearings?
All right, next item is old business. Is there any old business?
Not right now.
Not right now. Next item is new business, 160 Carlton Lane, septic variance.
Yes. So, our regulations require that certain variances come before the board for approval. I wanted to start bringing some of the stuff before you guys, instead of doing a lot of it in-house, so you guys can be exposed to some of the things we deal with for septic systems and kind of bring you up to speed on some of the things going on. So I've asked the engineer to come and present to you guys tonight. He's going to talk to you about the system itself, the variance request, and then we can go from there, okay? And I have it right up in your packets regarding the situation and the variance they're requesting.
So we can all see this, sort of.
Sort of.
My name is Thorson Akerley, for the record. I work at Williams and Sparagus in Middleton. We're a civil engineering company. Actually, my previous job, I worked as the health agent in the city of Gloucester, so I've had many of these meetings before. So for this project, Darren Winnie, the homeowner, reached out to us because he's renting this property and it's currently being served by a failing septic system. Tenants were getting irritated with it, and he's looking to fix the issue. So he reached out to us to do a perk test and submit a septic design to Brian and the Board of Health. This is, just for reference, this is Johnny Cake Street, this is Carlton Lane down here. The home is right on the corner of these two properties, or these two streets. So the reason we're here today is because, unfortunately, we didn't get a great percolation rate, so the size of the field was a little bit larger than we would have liked, and we either would have had to request a variance or setback reduction to the property line, which is a required 10-foot setback, which we did meet, or 20 feet from the foundation, which we couldn't meet. This is the foundation right here. We would have met it, but the bulkhead juts out just enough where we were just over or just under the 20-foot requirement at 16.4 feet. So we're here requesting a local upgrade approval to reduce the required 20-foot setback to 16.4 feet. Should also say that all of the homes around here are served by municipal water. There are no wells, and the applicant is hoping to repair it as soon as possible. He knows it's an issue, and he's looking to get it dealt with.
So I guess the question is there any place on the property that would otherwise be appropriate? Is that the place, the existing septic tank?
Yeah, so the existing
Or
tank
leaching
is
field?
right here, and one of the holes we actually dug, we hit effluent, started coming up. We were able to bury it, so there was no breakout, but yeah, this is all very wooded, very steep. This slopes down tremendously. Tons of trees in here. This is really the only lawn area on the whole property. To get in here would just be a huge cost. The water line's also right here. Other utilities, electric, gas. Yeah, I mean, it was really the only practicable alternative.
I can't see from where I am, but the elevation is going up to that side of the property is going up and not down.
This slopes down. This is elevation 170, and it drops about 10, it's 2 to 1, almost steeper than 2 to 1 slope going down to below about 150 in a span of about 10 or 20 feet.
So yeah, so if you look at the site itself, the constraints on it are pretty severe in terms of the slope, the topography, where the house is, where the driveway is, where the streets are, and the rear lot line. This was built in 1986. The original system was put behind the house, and then obviously the slopes and with the property is, it's the only logical place for it. I don't know what it would take to actually put the system down at the bottom of the slope, but that would be probably a huge expense.
And there is a wetland down here.
Is there? Okay.
Yeah, all
So
the way
getting down there and then putting in a system, so there are wetlands down there?
Yeah,
Okay. So that obviously is
You're not
a,
shown on the plan.
they're well over 100 feet away, but
Okay.
they are down there.
so where the system's proposed, they're over 100 feet. If you move the system to the other side of the house, they'd be within the 100 feet.
This would be outside the 100-foot buffer, but like I said, it's heavily wooded. It does
Yeah.
slope down much, and if we put the same system over here, we'd be asking for an upgrade approval there as well.
Yep.
Whether it be a property line or a foundation
Yeah.
setback.
And there's a concrete retaining wall there as well, correct?
I believe there is, yep, right here.
Yeah.
Stone retaining wall.
So the existing system where it is it in compliance with all the setbacks?
I actually don't know, because we never were able to locate it, because it's impossible to locate accurately.
Right.
I would guess that there are other parts of it that are in compliance with Title V. I don't know for sure. It does meet all the setback requirements.
Yeah, we don't have an original design plan on file. They do note the approximate location of the system. The tank will be pretty much in the same spot, and then the leaching trenches that are there now are similar to where they're proposing the new ones.
And the way that the previous system was designed wouldn't be how it would be designed today. So if you designed the old system on today's standards, you'd probably be looking for a similar waiver request. They had less stringent
Yeah.
requirements before 1995.
Yeah, so with this property, this project, this proposal, the only thing in the setback of 20 feet is the bulkhead. So technically it is foundation. It does have a stairwell going down into it. I think that at 16.9 feet, it does meet the intent of the code by being as far away as possible and still maintaining your rear lot line setback. I don't anticipate any effluent ever getting into the bulkhead or into the foundation, which is what the setback is intended for. So if there's any effluent permeating through the soil and everything, it does disperse out. So if you keep it far enough away, you won't get anything into that area.
And,
So you're just really asking just for relief of the 20-foot from the foundation?
Yeah.
Yes.
And Title V allows approving authorities to issue certain relief in the case of repairs. And the foundation setback and the property line setback are the two preferred least public health related impacts.
Now, this is the first, at least I believe it's the first that the board has seen these prints here, so please bear with me for a moment.
Of course.
Are you talking about replacing the existing septic tank and putting another
Yeah,
tank
tank
right
and
there?
leach field, yes.
Right there.
Yep.
So has the septic tank itself failed?
So the tank is just older. I believe it's incorrectly sized. It should be 1,000 gallons.
Oh,
The
okay.
requirement's now 1,500, or 1,500. What happens is the current leaching field clogs, doesn't take any more effluent from the house, and it starts backing up into the tank and then back up into the house.
Understand.
Okay.
So this is not, so you don't have a septic tank and a clean water tank, this is not a force main. This is just basically a standard system that you have.
Gravity trenches, yeah.
yeah,
And the
okay.
existing trenches are down here,
Mhm.
similar location. One was alongside of it. We tried to stay as far out of those areas as we could.
No problem with this.
So it's still going through its general review right now, but this is definitely something that's needed for the approvals. I'd rather get him here now before having him come back in a month. The approvals will be done probably next week, so
Okay.
they can get started and get this thing.
Do you have any problems at all with what they're looking for?
No, not at all, no. This is a standard, basic local upgrade approval.
So does the motion have to reflect the other approvals needed, or?
No, just you guys will issue, you guys vote on approving this local upgrade approval for this one variance request.
Is the
Everything else
local
will meet
upgrade
Title V.
approval on the plan here?
Yeah.
Yes.
Okay. So this would be the language of your
Motion.
motion, if you would choose to make that. Since you can
I
read it,
can't
Joe.
I was saying, I can't read it from here.
I think Michelle is likely to second
I
it.
have great eyesight,
But not that
good. Oh. Oh, great, now you're making me read all sorts of stuff I don't know how to say. I make a motion that in accordance with 310 CMR 15.405 1B, a reduction in the required 20-foot setback from a foundation wall to a leaching facility to 16.9 feet be approved.
Is there a second?
I second.
It's been moved and seconded. Is there any further discussion?
I kind of want her to read again.
You're out of order. There being no further discussion, we'll now move to a vote. All in favor of the local upgrade request as moved, please say aye.
Aye.
Any opposed, say no. The ayes have it. The upgrade is approved.
Thank you all.
Thank you for coming, appreciate it.
Thanks, Brian.
Are these done?
Yeah,
These are-
yeah.
okay. I'm just putting them back in.
Next item on the agenda is the camp discussion.
So, every year we have to basically permit and license the recreational camps in North Andover. The state had just updated and amended their regulations last April. So last year was a little chaotic, to say the least, in terms of the camps kind of catching up to speed with the regulations, because they came out in April. Some of these camps open registration in January. So this year we had a little bit better of a start on it. However, right now, as the regulations state, the deadline to have like the application and all the paperwork in is May 1st. And then to review all the immunizations and health records, we have to do about 20% of all the campers and all the staff. So a lot of camps require everything to be in, say, June 1st. And a lot of people, parents or guardians, aren't always compliant with that deadline. So when I go in to do the inspection, it's kind of, things are still trickling in. So I was looking to hopefully bump up the dates a little bit in terms of getting the paperwork in earlier and getting immunizations done instead of a week before the camp start date, getting them done like 2 to 3 weeks before, because what I'm finding is that I'll go in and I'll say, okay, so-and-so is missing measles, mumps, rubella, second shot. And so then some people will go out and go get the shot, or some people, if it's too close to the deadline, they will actually write a religious exemption, which is allowed under the regulations. So I don't know what we could really do with that at a local level in terms of the religious exemptions. And there is a clause in the state regulations stating that if there were an outbreak of any sort and someone who wasn't vaccinated, then we have the authority to exclude them from camp. But I kind of just want to give people more time to, when the parent gets notified and say, oh, I didn't know my kid needed that shot. Because some of these people are coming from out of state, some are coming from out of country, and their regulations in terms of their immunizations isn't the same as what we are. So that has been the biggest problem, is that time frame, and I feel like people just use that religious exemptions as a way to kind of
Safety valve.
exactly get to the, time frame that they need to start camp, but not always in a way that is probably the safest in terms of protecting everyone. So I was looking to just bump up the time frame of all of those deadlines, and then some of the sections in there are kind of redundant now that the state has updated their regulations. So I was just looking to kind of rework our regulations to make it more in line with what's already in place statewide.
So this camp season is already underway. We're already at the end of June.
This
So-
would be for next
So
year.
this is not an immediate need, so.
Right, I just
So-
want to kind of start.
So you just really want the authority to start working on cleaning these regulations up, changing the deadlines. Are you going to work with somebody on the board, or are you just going to just present us with a red
That-
line?
That's what I didn't really,
Red line version.
that's what I kind of didn't know. This is my first time having to do something like this. I had said to Brian, ideally, I'd like to have it done by December, because some of these camps are up and starting to register people in January. So I feel like the sooner we can get information out to them, the better. But, so however you recommend, if you want me to work with someone, if you want me to kind of say, this is what I'm seeing, this is what I think we should do, whatever you think.
I think that would be wise. I was going to recommend that, similar to what we have with the tobacco regulations. It's red line, it's, other than taking a look at the old state reg and the new state reg, like I opened up your email late this afternoon, I said, well, I'll look at it before the meeting, and the state reg is 33 pages.
It's overwhelming, I know.
fine print.
Trust us. we
And
know.
I'm saying to myself, well, what am I going to compare this with?
Right.
Well, I'm going to compare it with the old regulations, which is 33 pages of fine print. I didn't have time to do it. So if you can like redline and highlight similar to what we have for the tobacco regs, that would be very, very helpful.
I do have something that I created for the camps last year when the new regs came out, and it just basically highlighted what the changes were for all of, so a camp is considered 5 days. It used to be a 5-day requirement, now they've bumped it to 4 days. So if a camp runs for 3 days, they're not considered a camp, but if they run for 4 days, they are. If they run for 3 hours, they're a camp, but if they run for 2 hours, they're not. So there's like very, specific criteria in there, so some people don't realize they're a camp, and so I think just the more information and education we can get out there, but I have a document that I have highlighted those changes, and I can email that to you.
Basic summary.
Actually, what we have in our town reg, it says it's a state reg, and here's some minor changes and modifications, it's just 3 pages long.
Right, that's
Yeah.
just to use an addition,
Yeah.
because I guess,
Yeah.
I think back in 2005 when they drafted those, I don't think there was a policy in place for how to handle if someone was on camp property and not staff, so how to deal with an unrecognized person, so there was no protocol in place. I don't think immunizations were required in terms of being in the same line as the school requirements. So our town regulations say immunizations need to be based on what the school requirements were. So now that is actually, the state has now actually also done that. So, some of the things that we had, now the state regulations have, so it's.
So we don't need them anymore.
So some of that stuff, yeah, it would be more just for timelines and kind of just enforcing that, everything gets in a, not a last minute kind of.
Right.
And if anything else, we find that we can maybe
Yeah, we can always add in
fine-tune a
other
little bit.
things that we think are more beneficial to have in the local regulation, but like the May 1st deadline, we can bump that back a little bit and make that a little bit sooner, just for our own
Right.
purposes.
I think it's great. Why don't you just go ahead and go forward, move, and do what you want to do, and then bring it back to us, and
Okay,
it's likely that we'll just approve what you ask.
okay,
It seems reasonable,
okay.
Yeah.
serves the purpose,
Yep.
makes our regulation a little bit cleaner, gets rid of the redundant stuff that doesn't need to be there.
Right,
If we can make it simple, that'd be wonderful.
okay.
On another matter, I understand that you'll be speaking at the lecture series in the Senior Center this coming Monday,
Yes.
10 to 11:30.
Yes.
So I encourage anyone, you don't have to be a senior, to come in and listen.
What are you speaking
Yeah, I was,
about?
well, I don't know, I was supposed to speak.
Well, Frank and I spoke here a couple of years ago, we didn't know either.
And I'm not a senior.
I was supposed to speak at the end of the month, and then the schedule, they said, can you speak on Monday instead? And I said, sure. I said, but I'll figure something out. And she goes, I booked you like months ago. And I said, I was waiting till January, like the beginning of July, and then I would have figured it out. But, so probably I'm thinking I might do vaccine preventable diseases and kind of talk about, the measles. I get a lot of questions about measles right now from the seniors. How do I know if I need to be vaccinated? So I get a lot of shingles questions still. Some people are still confused about the different pneumonia vaccines, so I might just do something like that.
Yeah, when Frank and
Still
I
in the
spoke
works.
a number of years ago, we're coming from the same place, I don't know what we're going to say, but we looked at, like, I'm a cancer survivor, and he's a gastroenterologist. So we're looking at cancer from the perspective of a survivor. And I don't even know if I wasn't a survivor at that time. It was less than 5 years, and also his doctor. And it went over very, very well. So you'll
Yeah,
have a
the last time I
receptive-
spoke, it was like 5 minutes before it started, they're like, could you have time, can you do this? So it was kind of just like, so I've been here a month, and this is what I think I do. But it went over really well, everyone was great, and so it'll be nice to kind of go in a little more prepared this time.
Very nice.
All right, thank you for that update, and
you.
we won't take any action. You'll come back to us with something in the future. The next item is communications, announcements, and discussions, item B, tobacco regulation discussion. Looks like we have two interested parties.
Yes.
All right, do we know who's going first?
Want to have Dr. Hartman go first?
Dr. Hartman?
Thank you.
Thank you for
Please,
coming tonight.
Introduce yourself and let everybody know your background.
Hartman. I'm a pediatrician for 33 years at Westwood Mansfield Pediatric. I'm the senior pediatrician. I went back at 53, was the oldest guy in the class at Harvard School of Public Health and got my MPH in health and social behavior, and have done tobacco control kind of as a cowboy a little bit, I'd say, because I'm a nonprofit. I don't make any money off this, as I say. But I've connected with Jonathan Winikoff, and we were on the floor of the House when Tobacco 21 passed last year, and we got a standing ovation for our work. I've been to 170 Board of Health meetings for the tobacco, and now I'm on my 10th or 12th meeting on the mint and menthol restrictions or bans. So, because I'm angry of what happened after 21 and how this has really hurt our kids. So I wanted to, can I approach you all and give you some things?
Sure.
I have, and I'm hoping by the time I'm done with my talk, you may want to consider taking one of these. So don't be a jewel fool. Okay. It's very popular in my office now. So,
Did you get those from Martha Copley?
no. Oh, God. I've worked with Maura Healy. In fact, we've been teaming up with her a lot lately, her group. And then I want to show you, one of the things I find most incriminating, are the devices. I'm not on the microphone, I apologize. Jewel, most popular, I don't know if you've held it, you should really hold it.
Actually, we've had Ron Beauregard, our tobacco control
Oh,
agent
good.
from Healthy Communities, and he has been working with us
Great.
very, very closely for a long time. We are actually proposing to amend our regulations, which is one of the reasons why we wanted you to come to this meeting tonight, which does include flavor restrictions. That would include wintergreen, menthol, and things like that. So just to give you,
Give me a
yes,
heads up
yeah,
with everything.
yeah.
So I don't know if you've seen this one. This is the Novo, second most common one now. And this is the Soren. And this is an open panel, pod system where you can put tank devices like crunchy French toast, things like that in it. This is a 2 ml system, whatever one, so it lasts longer than a Juul, but by far the Juul is the most common in schools. So I ask you to open up your packets I gave you, and I'll go through right now.
Excuse me, what is crunchy French toast?
It's e-juice, nicotine e-juice.
Wow.
That they use, and you smell it? As I tell the kids, I hand it to them, I said, smell this, they say, and they go, wow, this smells really good. Then I say, yeah, put 2 teaspoons on your, 2 teaspoons on your French toast and you'll be dead, because it's a nicotine overdose. And a 2-year-old died in Fort Plains, New York years ago from drinking out of a tank vape pen. So I wanted to show you the first things I have there. The first thing is the map, which is a patchwork of different regulations people have done. Majority of the people there have done restrictions exempting mint and menthol. The second most common, which is about 11 at this point, have restricted mint and menthol, or basically banned it because they don't have a vape shop in their town, and they're cap and winnowing their permits, so that'll prevent a vape shop from coming in. Needham did it, Ashland's done it, and then there are 2 that actually banned the flavors, like California. The 2 that have banned are San Francisco. The 2 that banned are Brookline, and they have a vape shop in it, and that vape shop's going to go out of business. And Norwood has 2 vape shops, but what it did in its change was say the vape shops can sell the devices, but they cannot sell the flavors. So
Can they sell the devices if one is under 21 years old?
No, you have to be 21 and older, which is a real help in a sense of convenience stores are where kids get exposed to Juul especially, all the time. So whether they buy it there, which about 75% of the time they do, according to data from the Truth Initiative, they get exposed to it and they have a higher chance. Somebody who goes twice a week to a convenience store, kids who are in school, who use it, have twice as likelihood to buy tobacco products such as Juul as somebody that goes once every 2 weeks. So the next thing after that, and you feel free to interrupt me, I'm happy. This Jonathan Winikoff is, I'm the grunt, he's the academic. Jonathan is a Harvard-trained pediatrician who's a world expert on tobacco and children's health. I urge you to read this very thorough document. He's published in New England Journal, JAMA Pediatrics, and he's very well known. He goes internationally as well, like into the Philippines to deal with it, which has a bad measles outbreak now. FYI. So I want to talk to you about mint and menthol. And then I hope you'll consider the array of possibilities you can do to strengthen your laws. And I'll just go through how concerning schools are. I don't know if you've spoken to anybody, like your superintendent or principals, but they're very impressive when I talk to them about this epidemic. So, first page on this is, according to the CDC, Massachusetts is the 9th worst state for teen vaping. All right? So if you want to look at the cover page, and I was collating last night about midnight after I was in Lowell, so if I'm a little disorganized, it isn't because I'm drunk. But that's the first page. The next page, because I'll bust through this quickly, teens and elementary school youth, and yes, 4th and 5th graders, are now vaping at a rate 6 times the rate of adults in Massachusetts. Okay? While last year's YRBSS study showed 42% of Massachusetts kids had tried vaping, I feel this is a gross underestimation, in part due to the fact that this data is not stratified by age or by grade. And when you get to your senior year, probably 80% of kids have tried. Yes, it's anecdotal. I don't have data on this because nobody's really surveyed in a way that breaks down by grade, so we don't know for sure. But I'll tell you, most of the kids that I see, and I have a practice of 14,000 kids, most of the kids that I see have tried Juul, at least. In 2009, the FDA took the bold step of banning flavored cigarettes. However, Big Tobacco exempted mint and menthol, wanted it exempt. When all the flavors are removed from towns now, the flavor the kids go for, except exempting mint and menthol, the flavor they go for is mint and mango. I don't know how they're getting the mango, but you know how they're getting the mint. And there's menthol, too. I was in Lowell, and I bought pods for mint and pods for menthol for Juuls as well. So on average, menthol tobacco smokers delay quitting 20% longer than non-mentholated cigarette users. Boston and the state are moving towards bans on the sale of flavored nicotine products, including mint, menthol, and wintergreen. I was thinking about spearmint too, but I have to think about that a little more and ask the attorneys. To 21-plus smoke shops, and may enact even further restrictions, particularly the Bill 1902 that's there is now looking at trying to ban totally from the state, okay, flavors. So I've already said this one about my town, and I said this about the convenience stores already to you. And menthol cigarettes are slowing the reduction in overall cigarette smoking rates. From 2004 to 2014, the decline in cigarette consumption was greater for non-menthol cigarettes than menthol cigarettes. Youth smoking remained the age group most likely to use menthol cigarettes. Let me also mention one other thing, is when I was at Lowell at Yaya Vape Shop, I bought a e-juice called mentholated mango. So, and there are 15,000 different flavors now for tank devices. The next thing is nothing will happen in the state, I've been told this by the person who sponsored the Senate bill, because 1279, but in the House it's 1902, will happen unless a majority of the communities take real action. My preference is to ban. Now, you've got ban, you've got restrict to vape shops, cap and winnow, which some people are choosing to do, like a town like yours that has no vape shops in it. Some are just choosing to put mint and menthol and not cap and winnowing. But I warn you this, if you don't put cap and winnow in, there may be more vape shops than you want in your town, because mint and menthol is what makes the bucks for some of these. So they'll move into towns that don't have any vape shops. So that's a risk if somebody doesn't put in cap and winnowing as well. So menthol's purpose is to create and make a cooling effect in the back of the throat. And as adults, it reduces the harshness of cigarettes, smoke, and suppresses coughing. These effects make menthol cigarettes and vaping flavors more appealing to young and experienced smokers. So think of it this way. Menthol initiates the addiction. Nicotine continues the addiction. And that's what it does for kids. So on to flavored e-juice a little bit more. Does banning menthol have any effect? The answer is yes. This is from Dr. Winikoff, who was a lot smarter than me. I think these papers, and I have the papers here for you, the Ontario papers, are highly relevant to the banning of mint and menthol in cities and towns. Basically, the doubling of adult quit rates after menthol bans, 29.1% from about 15%. So remember, banning will benefit the adults too. They will are more likely to quit, or at least initiate quitting. What harm does mint menthol cause? As I told you, those first few. And the final last one. In this area, you know, if you vote for your town, you're also voting for the African American LGBTQ community and everything, because what you do is going to affect what the state bill does, period. And that's what I want you to keep in mind. Look at your vote is more global than just your town as well when you look at this. So the nicotine in Juul has a patented formulation linked with benzoic acid, the nicotine with benzoic acid, and it's suspected to cause a bigger head rush than cigarettes, making it more addictive. It lowers the pH in the lungs, raises the absorption of nicotine, and I hear this from the kids who continue to do it, who say, I like that head rush. Unfortunately, they have to take more and more. If you wanted to see 2 YouTube videos that I show kids, there's one called Smoke and Mirrors in vape documentary, and the other one was Jewelers Against Juul. And those are interviewing 14 to 16-year-olds that are addicted to Juul. So, quotes from Dr. Winikoff's letter, you have there, I'll just highlight a few things. Eliminating sales of flavored tobacco is a necessary move at this critical time to give the 78% rise in adolescent electronic cigarette use and the reversal of decades of progress in tobacco control. Kids who use electronic cigarettes are over 3 times more likely to use combusted tobacco. And what I see the kids do is they go to the Juul, then they take what's that Sorn, the green one there was one called the Sorn Drop, then they start doing dab pens their senior year with THC in it. That's what I'm seeing more and more of too. Over 85% of users state that flavors are the reasons they started using tobacco products. This includes mint and menthol. So, Juul is not, let me repeat, is not an adult smoking cessation device. Juul is an adolescent nicotine initiation addiction device. Let us also remember there have been 4 papers now, peer-reviewed papers, that have shown that basically e-cigarettes, that includes Juul, double your risk of heart attacks because it does endothelial damage, apparently with all the toxins in it. I don't know if you know the toxins. I'll go through some of them with you. Propylene glycol, which they say is benign. They tell kids it's benign because the FDA approved you could eat it. Well, there's a difference between eating and inhaling, and kids don't seem to get that until I review the physiology with them a little bit. And if that's overheated enough, they say it can only happen when it's combusted, it goes to formaldehyde and acetaldehyde. And propylene glycol itself is antifreeze, a form of antifreeze as well. You have diacetyl in all these. Diacetyl is a toxin that causes popcorn lung, which is basically like emphysema as well. In high doses, we know what it'll do. Low doses over years, no one knows. But we now have the new generation of lab rats. Our parents were the lab rats from the past. It skipped a generation, and they brilliantly bring it all back so the kids don't really know. I go to schools and I ask the kids, raise your hands, how many of you have relatives who are died or dying of tobacco-related diseases? 10%. That's not much compared to what it was when I was a kid as well. Three of my grandparents died of smoking-related deaths, and my mother died of smoking-related deaths. My mother smoked during my pregnancy. I read the Surgeon General's report. I have ADHD. I've had learning disabilities. I have a club foot. Don't be surprised about that. That's why I can do 170 meetings. A club foot and learning disabilities. And my first grade teacher told my parents it wouldn't make it past high school. So I ended up got into 7 medical schools. So, and Georgetown turned me out down in undergrad and accepted me in medical school, and it just felt so good to say no to them after that. So this is something about the Truth Initiative in the African-American family. And if menthol cigarettes ban had been enacted in 2011, it could have saved 320,000 lives by 2050. So I can also offer you some of the papers, but I think Dr. Winikoff's paper is quite compelling. I can give you, Brian, if you want this, that's the paper, on the Ontario paper I mentioned. This is a review of articles that show that the conclusion is the strength and consistency of associations in these studies around menthol supports that the removal of menthol from cigarettes is likely to reduce youth smoking initiation, improve smoking cessation outcomes in adult smokers, and in turn benefit the public health. That's just the abstract. As well. Then I also want to say the people that I face all the time. When I did Tobacco 21, I never saw a lawyer in the room. The convenience stores now, retailers, have a lawyer. And I'm surprised there wasn't one here tonight, but they will be at the public hearing. Some of them, I was told, in fact, I think it was Lowell, may have been, or somebody else recently, was contacted for what their regs were going to be. They were asked by a company that's not tobacco, but is hired by tobacco. So I'm going to give you this as well. What this is Professor Mark Gottlieb of the Public Health Advocacy Institute, who I work with at Northeastern. He's a tobacco law professor. Actually, they got a huge suit against big tobacco recently. And he shows follow the money with the CR gets its money. Okay, and follow the money, because these businesses are so dependent on tobacco, and that's got to change. My business morphed. I've had to deal with having 2 rounds of computers put in now that have changed, electronic medical records that have changed, and last time I finally hired a scribe so I didn't have high psychiatric bills because it was really bad, and I'm a terrible typer. So take a look at this. And this is all about uncovering who is really behind this, because all the convenience stores are just pawns in this situation. And like I was in when I was in Norfolk, I stopped at Dunkin' Donuts, and what I noticed is they were morphing their business. They're adding a Baskin and Robbins. So I saw one convenience store that had a restaurant, a convenience store, and a car repair shop, all in one. So I thought that was pretty creative thinking on their part. So I'm happy to answer any questions or.
It's a good presentation.
Thank you, sir.
Thank you very much. And it certainly is encouraging to note that as you have down here, which we already knew about anyway, that Maura Healy, and she's our Attorney General, was the first state Attorney General to sue Jewel for marketing strategy. Of course, her predecessor, as I mentioned a few moments
Right.
ago, Martha Coakley, works for Jewel.
I know.
Jewel is out of, correct me if I'm mistaken, San Francisco.
Yes.
And San Francisco has just put a ban. So what's happening? What is this ban on? A big city has a ban on these vape devices?
And there are ways of skirting it a little bit, and this is why the language has to change. I called vape shops, okay? And what they had done was some of them were selling the components now, the e-juice and the flavoring, and people would have to mix it. But that's a lot harder, so that's a big barrier for them, all right, as well. Now they're out of business because then what they've decided to do was take nicotine delivery systems and ban from selling those, Juul, all that, which is interesting, as you say. And, you know, Maura Healy got about 50,000 pages of documents, which they're still working on in a process, in a suit. We've asked for updates, but they can't give it really right now. Juul is evil. It always has been. And may I show you the pictures? This was the 2015 Juul launch parties we found on the internet. And we juxtapose what the CEO says and look at the pictures. These are not 40 to 60-year-olds trying to get off cigarettes. So may I show you this? And you can keep these too.
While you're walking over here, Wall Street Journal, on a very regular basis, they have a full-page ad from Juul saying that they support doing basically whatever it takes to assure that those under 21 years old do not have access to these vape devices and so forth. And it's a marketing scheme. I suppose it makes some people feel warm and fuzzy. I prefer they get out of the business altogether, period, but nevertheless, it is what it is. Full-page ad.
And this,
Regularly.
right, and this is the hypocrisy when you look at these pictures. And the other thing is what states, I know House Senate Majority Leader McConnell has proposed a bill to 21, but it's really a decoy. I mean, what big tobacco is trying to do now in big vape is inhibit, is have the state control preemption, okay? In other words, in this state, we don't have preemption. Some states like Texas have it. So say the state puts the age 18 for cigarettes, okay? The towns can go higher than that, but not lower than this. Correct me if I'm wrong on this, Ron, please. So not lower than that, okay? But in places like Texas, they can preempt and say, oh, you put 21, no, you got to put it back down to 18. And that's what they're trying to play with. They're window dressing, and in the background, they're fighting to have all of them to have preemption. See, the beauty of Massachusetts, why this can work, there are 350 towns that determine the destiny of their own health, okay? They can't go to every single town, although the lawyers are coming with me more and more now. I like a battle, but anyway, what ends up happening is they have to kind of keep track of you and what you're doing, and it's very hard when it's decentralized like Massachusetts has done it, and that's how 21 was successful. The challenge is you have to have a majority of the towns. Well, a majority of the towns was 75% of the population when it finally passed in the House and Senate, and that's the challenge. And I'm here, we're at number 13. I'm here to go all the way with it. And I would say, I hope you consider a ban, and I hope, Ron, I apologize, but as I am biased, there's no doubt, I'm completely biased about this, because I'm here for the kids, and I hear the things. You should see my car. When I was driving here, I had, don't be a Juul fool, Juul, get out of my school, on the side of my doors. My wife won't drive in the car anymore. 2 guys pulled out their Juuls and waved them at me. Some guy came by in a motorcycle and goes this to me and everything when I drive by. So, you know, and kids in my practice say, you know, your car is famous on Instagram. Thank God it's not me. So, thank you.
Thank you for
Thank you for
coming.
coming, we appreciate your time.
Just a comment. In 2015, when we updated our tobacco regulations, we discussed banning all flavors. And one of the reasons that we did not ban menthol flavor was because it was, there was a pending case, I think, with Providence, Rhode Island. And am I wrong about that?
You got everything right on. It was actually, the case in Providence was settled, and we were relying on our experts and our legal advice to say that because that language exempting menthol and
Wintergreen.
wintergreen, that's it, that was carved out, and that was based on the federal law on flavored cigarettes, which exempted the second most popular brand of cigarettes, Newports. So I feel like as though that was,
That was
It
then,
was more of a political decision than
Right.
based on rational.
Well, speaking of federal laws, I believe that there was a bill in the U.S. Senate supported by Mitch McConnell and others, and he's from Kentucky, to increase the age of smoking to 21. Am I correct on that?
It is, but it's window dressing, we think.
Oh.
What I've heard is, because what they can do is unless, because states can still stay at 18 if they have preemptions, is my understanding. I'm not the legal person on this, but I'm very concerned, and Tobacco Free Kids is very concerned about what that bill's actually gonna end up doing, whether it's gonna be more harmful and helpful. I don't know the legality, that's you and DJ Wilson and Cheryl Zamora.
I think at best, I don't know the details of the federal legislation, but the likelihood is, it's kind of like when the tobacco companies suggest ways to set up smoking cessation for youth, where they word things. Their motives are not in parallel with the public health advocates. The 21 actually, Doctor mentioned this, that when we have now the majority now of our collaborative has gone with the flavor restriction, as you have with the exemptions, and 21 was often offered at the same time. There wasn't a peep about 21. 21 is more of a, in fact, DPH warned us. They said, look, there were many towns were going with 21 alone, and they weren't considering the flavor restriction early on. And people, didn't want to think it was just like a magic pill. Oh, 21 will solve all the problems. It doesn't. So 21's become really just certainly Massachusetts, a deal finally for the tidal wave of the towns. But across the country, I suppose in some states like Kentucky, it's a big deal that it's truly window dressing, comparatively speaking, to flavor restrictions.
Dr. Scott Gottlieb, the former FDA director, just had an op-ed, I think it was this week or maybe this past weekend, in the Wall Street Journal. He made a distinction between, first of all, he said that the FDA is going to move towards regulating nicotine content in these flavor packets, but he also seemed to kind of try to carve out an exemption for the vape stores as opposed to Juul. It seemed like the gist of, or the thrust of his letter was something to the effect that Juul is not a tobacco cessation device, but these other ones may have some, and they could apply for an FDA exemption based on this, that, or the other thing. Perhaps you two could educate us on that.
I know Juul is something that goes without saying, is that Harp was saying that Juul is, not in the business of being a smoking cessation device. I think that was even proven more by the fact that they now owned a third of their company is owned by Philip Morris, or Altria, or Philip Morris, as we know them, and they for a cool $14 billion. So their purpose is to get the marketing people, to get the organization, get the idea of just transferring nicotine addiction from one brand product to another. In regard to the system, I don't know. I remember that I read that. All I can think of, and more to add to this, is Juul. As I go to many of the stores that sell Juul, their standard percent was a 5%, and that used to be labeled. But now there's a big bold, the new boxes, there's a big bold 5% to distinguish it from the 3%. Finally, maybe because a big criticism of Juul is that It was never meant to get people off of nicotine, to substitute the form or the method, we can't get it. So I think they may idea it's a throwing a bone, you know, just sort of like a little bit of smoke and mirrors, so to speak. To say, we're going lower. Whereas the methods, when I do go to the vape shops, they may be all hogwash, you know, in terms of study-wise and such. However, I don't question, and this, we may differ in this regard, I do know some vape shop owners, they truly believe and they've truly seen people quit with this method of reducing, you know, everything from a high level to a zero level, and some actually continuing to vape at a zero level. I have no studies in that regard, and I've always thought the tragic thing, I think it was a Michael Siegel, was it over at Boston University
Yes,
School of Public Health?
it is.
He had, earlier on, I did a lot of reading for him, he was a Yale-educated physician, I believe,
Yeah.
and a really smart
He's
guy.
kind of the enemy,
He has
quote
been-
unquote. He's an
yeah.
honorable guy.
He's an honorable guy.
Who's very honorable, and he speaks the truth in his perspective.
But what I think he was, and even he has been very critical of Juul.
Right.
You know
Definitely.
what these things are,
Definitely.
and you know more the details of how the salts work and how they're very addictive. What he said was that the electronic cigarette had the opportunity, and I think he would maybe say, I mean, words in his mouth, but maybe say, it still has the opportunity to be a great reducer of morbidity rates due to nicotine addiction, because it's not just that question, it's based on the aerosolization of the product. However, I think what's happened here, and when I challenge some of the vape shop owners and some of the retail stores, managers and such, is if this product was to do what it was envisioned to do by its initial creators, and that is to be a cessation device, where's the FDA application? Where's the hard work to make this join the gum and the patch and the other Chantix and all of the other methods of, legitimate methods to try to wean somebody off of nicotine? They're not there. And I saw that I didn't see what you showed, I don't know if I've seen that one, but I remember when Juul first started coming out, I was in Billerica, and they had a screen a little bigger than this size, right at I know the station, All Town, it's called All Town. It's like a Circle K. Right at the register, it was a continual loop of model-esque young men and women. I mean, real snazzy, Juul. It had nothing, I was up in arms with it, and there was nothing I could do about it, unfortunately. I tried to put a little pressure, it did disappear, but I don't think it was doing my efforts, it just was there. It's a constant loop. And now they've changed it, if you listen to AM radio, or they tell you, oh, they have someone practically with a hoarse voice. So, you know, I used to smoke, and this is saying. I never want to offend the folks that have come up to me and told me that they switched to Juuls and it's helping them. And I know there's a little bit of you probably know a heck of a lot more about the whole British twist on this.
That's what I wanted to
because,
talk about.
The Brits have had historically a different view of this, you know, groups that are analogous, I think, to the American Cancer Society, who have said there's some harm reduction. What the FDA, I thought, took head on was they looked at this as truly a two-edged sword, and they had to pick the sword that was cutting the most. And that was, you had the potential for people to quit and to go to something less harmful, albeit be a guinea pig or a lab rat, as you will. But more than likely, you know, the cigarettes are up here, it's not necessarily a choice between lead and ingestion and asbestos. Hopefully it's not that close. You know, it's maybe, you know, here and here, you know, this sort of thing. But we don't know, and the whole approach has been very frustrating to me, and we have been sued in Billerica. I just found out yesterday, that we were sued on Tuesday, a few towns that have adopted this restriction. Actually, interestingly, Billerica didn't adopt the flavor restriction. They went for what some would regard as a punt, which I don't blame, but they went more for the vape issue for the youth. And so what is supposed to happen on July 1st and supposed to enforce it is to have all vape products, regardless of flavor. It doesn't matter whether it's the pod, whether it's the device, everything is going to be removed from all of the shelf in the convenience stores, except there's one smoke shop in town, and as the doctor had mentioned, Billerica in those same regulations that did this, they put in a cap for retail tobacco stores, which are the adult-only vape smoke shop, to 3. And we already had 2 filled up, so I mean, they're not good. So that's it, we're gonna have 3. But now we're sued. I know a couple of towns have held off a little bit on enforcement, but the good news is, I haven't looked yet. Richard Berube, the health director, is gonna give me the brief. I know Cheryl Zavarro would as well. I just like to take a look at it myself. I looked at about 5 articles that have been written on it, mostly from trade organizations supporting the convenience stores, as well as, I don't know, the Worcester Business Journal seem to be the most neutral. And they're using words like arbitrary, discriminatory. I mean, in the truest sense of the word, I guess it is discriminatory for a reason. It's saying that, you know, it's gonna be 21 and over, and no foods, and distinguish it from. They use words like no plausible public health rationale. They want to level the playing field. It's arbitrary. All of these things are untrue. And Cheryl, she'd probably be like, probably see steam coming off her head if she heard these things, because I've seen it firsthand, just recently in Chelmsford.
So Barica is being sued. Do they have the most aggressive regulation concerning tobacco in the state?
Can I mention a little bit about that? Because I've worked with Mark Gottlieb, who works with Cheryl.
Yeah, because you said like there's over 350 cities and towns in Massachusetts, and
Is that the Cumberland Farm one?
Yes.
Okay, first of all, you don't have Cumberland Farm here. I checked that, okay? The Cumberland Farm is suing towns that have Cumberland Farms in them, okay, number one. Number two, and the suit, I don't want to quote Mark Gottlieb, but he feels it's a weak suit, so I am quoting him. So, and the Somerville settlement for being sued too was another one that's overcome the issue, because people are waiting because they don't want to get sued. But what happens is, people are moving forward, and the judge denied their motion. When they had a hearing, they didn't give them adequate time, they didn't inform people well enough. So it was basically like you weren't giving your Miranda rights. All right, and that's the technicality that got in Somerville, and the judge didn't buy it. The Cumberland Farms regulations about discrimination is exactly the point. This is a harmful product for kids. You have to discriminate against kids for kids' sakes. It's basically.
They're arguing in this, from what I can see, if the references are accurate, they're basic, and this has been done at every hearing, is they're arguing, number one, that the convenience stores, collectively, all convenience stores, have a great pass rate, that they have great approval rating from the FDA. They make the argument, this is the first time I heard this one, they make the argument that up to 80% of all vape sales to youth are through either the internet or for a friend, social sources, as they call it, or relative. And the third they mentioned, which is really meant to make, I think, this is going to be a very factually driven case, I think, just from the little I've read, is they're arguing that the vape shops and the smoke shops have a third, they sell to a third of the youth, whereas the convenience stores sell to all but, I think, 6%. So they use, they're building a case as best they can. But Cheryl, I always say with studies, and with your chapter 111, there has to be, no one said that public health officials need to know the answer. God, if someone knew the answer, they'd patent it and sell it, and they'd make a fortune to know exactly how to make this work, to reduce use of vapes. All it needs is and I might be misquoting the legal terms, but it's analogous to what they would call a rational basis. Would reasonable people, could there be a rational argument to be made? And I don't see how much more. And the other thing, by the way, that seems really obvious is we all knew, we mentioned this, Doctor, is that we all knew mint, menthol, and wintergreen was a flavor when we passed the non-mint, menthol, and wintergreen flavor
We did.
restriction. But we were a
We
little
carved it out based on advice from the legal
That's
staff.
correct. And it was good advice, and Cheryl and DJ aren't shrinking from that. It was something that.
It's 4-year-old advice now, and the world's changed.
That's right.
And the world's changed as a result of things like Juul.
Right, we didn't have Juul in 2015, we came up with our regulation. That was a phenomenon of 2016, 2017.
And speaking of a changing world, I saw a series of old ads on TV recently, and one was Camel cigarette, the choice of doctors. I said, whoa.
In the Life magazines, I've seen, I was a kid with this. So, can I make a few more comments in addition to what was said? First of all, the CDC has not endorsed this, okay? CDC is very worried about what's gonna happen to kids. Secondly, a pod of 69 milligrams, even though it says 59, when it was independently assessed by some university, it actually has 69 milligrams, and most of the things in the tank shops are higher amounts of nicotine, okay? And anyway, that, you can only have 20 milligrams in a pod in the European Union, and that includes Britain. So basically, Juul is banned unless it doesn't. Even the 3.5% is higher than the 20, is higher, it's still higher than the 20 milligram limit, bless you, by the way. My concern in all this process is onboarding of kids and offboarding. And I really think with the best, when you look at that article that was just put out about how e-cigarettes are twice as good getting people off cigarettes than nicotine replacement treat therapy. I went back and I actually wrote a letter to the journal about this. I went back, and this was conferred by Dr. Winikoff, and this was helpful when I went back to school a little bit. Look at the data. The data is the goal to get off cigarettes. The goal is not to get off cigarettes and nicotine. And when you redo the math in there, what you find is NRTs, nicotine replacement therapy, is twice as good at getting you off nicotine and cigarettes altogether. So this is the concern. And remember, they're using things that are much weaker in concentrations than we do. And I'll give you another example. Not everybody in England thinks this is the best thing since sliced bread. There was an article in Lancet, a commentary. In the Lancet it said, they have this month called Stoptober for years to try to get people to get off cigarettes. Well, it started to get sponsored by vape. And it wasn't just Juul, it was vape, period. And they called it Swaptober, okay? The NHS, you know, basically the National Health Service, is not thrilled with e-cigarettes, even though the Royal College of London thinks it's the best thing since sliced bread. And the unfortunate thing that we deal with when we deal with Dr. Siegel, who actually has sent letters through the convenience stores. He's not being funded. This is an honorable guy. But he sends letters saying what it can do, and that letter from Dr. Winikoff will counter that, and you will probably get a letter, his letter, from the convenience store owners with this, okay? So this is a huge battle still that's ongoing. And then there's one other thing I wanted to say. On the onboarding, offboarding. The whole issue about they only do a third of the Juul, okay, sales. Who cares? It's a third gone, okay? It's 1/3 gone. I don't care. It could be 10%. It's still a chance to get off. And by the way, Moore Healy has sent the 2 biggest internet vape distributors cease and desist letters until they figure out confirmation on ages. Now that doesn't mean, you know, that they're not still getting through, because they are. And the big trick I just found out by one of the health agents is Amazon and Whole Foods, okay? Kids would go on Amazon when there was pods there and vape pens, which they don't have now. They have the skins, by the way. You can put it's like book covers. You can put a cover on it now. Kids order it, send it to Whole Foods. They have a ticket. They go take it to the front. They get it. They get a key for a locker and open up, and it never went to the house, so the parents don't know. They have now stopped doing that because Moore Healy wrote them a letter. We think that's what caused it. Okay, just like today, I found in Lowell a new form of dip, and the dip says no tobacco, nicotine. Well, that's false advertising. If the nicotine was extracted from a tobacco leaf, it's a tobacco product. That was the settlement in Rhode Island. So keep that in mind when you hear stuff like they're really trying to bounce through this stuff, you know. you've got a really, really dedicated, I always think the tobacco regional coordinator, is that what, because you coordinate with the agents, you know? So because, I mean, what he went through and what he read, I would like to see that trade stuff. I would love to see what the trade stuff, read about it, you know, too, at some point, you know? Because I'd like to see what the trade is saying. So,
They're repetitive, they're somewhat repetitive.
I'll read it anyway, because there's something a little different. Or I can give you my email, what's easier for you. But I'd love to read about the trades, you know,
I'm tired of reading them.
I'd love to open it up to questions, so other people on the
So I
board.
guess I'll make my comment of, as a practicing pulmonologist.
Oh, yeah?
So I actually have 0 patients that have ever quit with Juul or vaping. Most of them that will switch over, just like the taste, and they say, well, this is a great alternative. The American College of Chest Physicians hasn't really come out with a hard stance of no. They're like, it's better, maybe, but there's not enough data to back anything up, which is the usual case. I have not yet seen a case of popcorn lung yet. I'm waiting for that first one. But the American College of Chest Physicians, in one of the most recent journals over the last couple of months, did come out to say that it does impact mucus clearance in young kids. So it definitely impacts mucociliary clearance within the large and the small airways. So I guess the other thing, and I'm actually not sure, what is the cost of an average Juul, for example?
It's, man, $45 for a starter kit, $16 for 4 pods, okay? Which is, each pod is a pack of cigarettes, a pack and a quarter of cigarettes.
Okay.
What it is. Soren, that was $29. My Blue is $19.99. They were selling it in convenience stores for $1 for a month, because they were trying to hook kids. I have a question for you, if you don't mind. Have you seen any eosinophilic pneumonitis? Because there's been reported cases now with basically allergic reactions in the lungs.
Correct.
To,
I have not seen it personally, but I do have, one of my partners has seen a case, yes.
And as one person pointed out, a pulmonologist, a pediatric pulmonologist said, the diseases are going to be different than tobacco. We can't seem to equate cancer, all this stuff. Well, seizures are now associated with, it's not definitive, but associated with some kids using e-cigarettes. The second thing is, as I said, was the eosinophilic pneumonitis was the second thing. The other thing, I go to schools and I talk. I've done about 10 presentations on vaping and Juul. I never show teenagers those pictures, please. That's the forbidden fruit they'll go nuts with. Please don't. And I show them cadaver hearts that have heart attacks, strokes, and hemorrhagic strokes and all this. You know what kills them the most? The vape tongue. When they stick that tongue out, when they see that tongue stick out, I hear more than anything, ew!
It's because they can see it.
Much louder.
You're not seeing the heart
Right.
firsthand,
Well,
the lungs
and they said, "You
firsthand.
wanna kiss this tongue?" And you know, it's, oh, no, I don't wanna do that. So, and if you do talks, there are 2 things I tell you with kids. Because I've got kids evaluating in my office. Mine, the grosser the better, less text, and more social media, YouTube videos, things like that as well. So, but again, I hope the minimum, I would say, is you cap and winnow and restrict all these. I hope the maximum you'll think of is you ban it, okay? But remember, if you don't cap and winnow, you're running the risk of a vape shop coming in, is what you're seeing here too, so. Thank you.
Thank you.
Thank you. You want to talk about the regulation revisions?
Yeah, sure.
Do you want me to leave?
No. No, stay and
I'm
take part.
completely unbiased.
Stay and take part.
Someone might be more of a compromise.
I know.
Yeah. Yeah, come on up.
It's a step, and that's what I want to mention, Ron just mentioned about flavors. I take the Gandhian perspective. The first time I started talking about age, I was debating Cheryl Zavara in Easton. She didn't want 21. And it was a grant what DTH got from the CDC. Their goal was to do flavors. Jonathan Winnicott and I said, we want everything, but we started with 21. Because General Smuts became a good friend of Gandhi's after he imprisoned him 3 times. The thing that happened is we've become collaborative, very collaborative now as a group, at least from my perspective, you know, because we're in favor of this all. And which way was incremental, who knows? Who cares? As long as it happens, the flavors and the age restrictions happen. That's what we need. Because when Needham went to 21 in 2005, the only place in the United States and maybe the world to have done this, they had a 47% reduction in tobacco use in their high school, as compared to Wellesley, the next town over, that had no regulation. Now remember, this is all before the internet, too. Really, people were using it. So it's a little bit different now because, you know, social distancing is not the same thing anymore. So, thank you. No, this is John Quincy Adams.
Oh, it's John.
And he has, if you look at a statement he wrote, he tore out his tobacco fields because he was so upset about his addiction, and he said it was really hard to get off of it.
Interesting.
So, just an FYI.
Really pioneering.
Thanks. Okay. So yeah, just to let you guys know, this is, Ron has incorporated the things that we discussed at the last meeting into a hard copy of things that we debated on what should or shouldn't be in there. That you guys had tossed around a little bit. So this is everything. This isn't obviously a final draft by any stretch of the means. This is just to have something in front of you on paper. We can go through some of the changes, you can discuss some stuff. I'm thinking after we do this, once we kind of narrow down what we want to do, we'll do a public hearing and we'll send those out to other retailers that we're going to have a public hearing to discuss and open a public hearing on tobacco regulation changes. And then we'll do that at the next meeting, and then we'll go from there. But this is just a informal discussion like last time, but it's on paper and in front of you.
So just because we have a televised audience, could you just reintroduce yourself?
Well, yes, it's Ron Beauregard, Health Communities Tobacco Control Program, serving 17 communities, including North Andover as your tobacco control agent.
Thank you.
You're welcome.
Please continue.
Oh, well. Which way would you, there's 2 ways I can kind of rifle through it real quick. Do you have you don't have the regs in front of you, do you? Or do you?
Yeah, we have the
You want to
draft.
just go boom, boom, boom,
Let's
each
just go
page?
through it.
We'll just go through it so that way you don't think I'm hiding something. No, I'm just kidding, but it's easier that way, and I'll do it
Yeah.
fast, unless
Yeah.
you want me to start.
Fast.
Okay, so the first page here, first you're gonna notice throughout the whole draft is that the term nicotine delivery product is eliminated. And that's because there's a new definition of tobacco, which will include both nicotine and arguably no nicotine vapes. So that's why that term was put in initially when you passed your regulations, because we wanted to be sure that
was
we
covered.
captured people doing electronic cigarettes and such. But now we've really expanded it, which would include that new product the doctor had mentioned, where I've seen it. It's a chew. It says it's no tobacco, but it has nicotine in it, and we would regard it as a tobacco product.
So is that a state law definition that we don't need to mirror anymore?
It's the nicotine delivery.
Yeah.
No, that was a DJ Sherrill model regulation that was preferred for us to offer to you. Now that there's been a switch.
So this has been vetted by the public health
Correct.
legal team? and-
Yes.
So I just want to make sure that we don't open ourselves up to challenge.
No.
Yeah. the
Well, there's
tobacco-
always the possibility of a chance, but no, this is based on the model
Successful
regulations.
challenge.
Yes, yeah.
Yeah. So instead of having a nicotine delivery product definition, it just gets included in the tobacco product definition now.
Okay.
So
Okay.
expand
So-
that, add it all into one.
So the first, and of course, this draft, as Brian had mentioned, you wouldn't have all these things in here because some of them are in here to
do different things. So on the first one here, characterizing flavor, 2.4, this is just, I know you haven't read these probably regularly, but just, thoroughly recently, but basically characterizing flavor is the way that that term is referred to in the term flavored tobacco. And it's anything with a characterizing flavor. This would simply remove the menthol, mint, or wintergreen, and then add it as one of the examples of what is a flavored tobacco product, okay? So that makes that provision work. On the next page, I put in the definition of electronic cigarette. This is only because we had discussed what Bill Ricka had done. Some don't see favor with this at all. It's a compromise, I guess, of sorts. What it does is the biggest criticism of it is that it doesn't touch the large and very popular Newport brand of cigarettes, as well as other menthol cigarettes. And what this electronic cigarette is in there, the definition is in there for, is a later provision I'll show you at the end that just says nobody can sell electronic cigarettes except for smoke shops and vape shops. So that's why that was added in there.
So would we keep e-cigarette and electronic cigarette?
Oh, e-cigarette.
So 2.8,
No, that's a good
Oh,
catch.
okay.
You wouldn't need that. You wouldn't need
that
that.
would be stricken.
That would be stricken.
So could we just kind of call that the new 2.8?
Yeah, they're actually, if I recall, they're almost the same, except we added that language at the end just to make it clear that it's regardless of nicotine. Yeah, that's what it is. It's regardless of nicotine content, and it's not limited, that we actually spell out some of the things: pods, vape juice containers, cartridges. Just want to be clear. So but that's a good catch. We would if that's put in under 2.9, 2.8 would be removed. Flavored nicotine delivery product is just removed because it would be redundant, and there's no need to it because we're going to have a tobacco products definition. The next page, nicotine delivery product, is the very definition of it, that's eliminated because you're no longer going to need it when you see the definition of tobacco product. The next page is finally the tobacco product definition. This one here, without reading the entire thing, it's important to note that toward the end, toward the middle, it says, you'll see the part where it begins with the 1, 2, 3, 4, 5, or 6 down, nicotine, e-liquids, or other similar products regardless of nicotine content that rely on vaporization or aerosolization. And of course, it doesn't include, truly FDA-approved smoking cessation devices. But basically, tobacco product is anything that has nicotine in it, and if it's vaporized, and this gets us in a little bit, this will be a judgment call for you to direct me, but I have a couple of jurisdictions that we've already applied it where they have a permit cap. Now, not a particularly unpopular establishment such as a hemp shop, where they sell CBD and hemp, want to also sell CBD or hemp vapes. And then it's run by me to give a definition, whether it falls within this definition or not. This is really important in cases where the cap has been met, and now you've got a vape shop, a hemp shop coming in, and now they want to sell the vapes. But they say there's no tobacco and there's no nicotine, it's hemp or CBD. And I rely on this language that indicates that it's regardless of nicotine content, which the way I read it means doesn't matter whether it has nicotine content, it's anything that can be vaporized or aerosolized. There could be a challenge in that regard, but so far we've prevented hemp shops or the hemp shop type of establishment for selling vapes that have no tobacco and no nicotine. So
This is gonna come up.
interesting. These are things
Yeah.
a lot of times these definitions are trying to catch up what is available. And
So Ron, could somebody successfully challenge our regulation if this is called a tobacco or nicotine regulation, if it applies to another substance like a cannabinoid type of?
yes, it could. Although
Should we have
marijuana,
a separate regulation on that
oh,
regard?
well, for the vape, I would say, obviously, if it was a THC vape, that would fall under the cannabis control. It's a marijuana product. Hemp and CBD are not marijuana products, even though they're cannabinoidal.
Right.
Never can say that word very well. But that's regulated by the Department of Agriculture, Massachusetts Department of Agriculture.
So we don't have a say in that? But
You
we
have-
can regulate vaporization of any product.
You can, and you also can have a say in the CBD. There's a lot, I just went to a North Reading Board of Health meeting last week, and I want to say it succinctly and not inaccurately. It appears that the Mass Department of Agriculture has indicated that food products with CBD or other products that indicate they're for therapeutic use are not permitted for sale.
Correct. You guys have this in your packet as
Gee,
well.
did I do all right?
Yes, you did.
Sweating here.
Perfect.
I'm not a CBD expert, never, some of my.
I don't want to get
Yeah.
too far off the
Okay.
reservation with regard to this regulation.
Okay.
I just want to.
You didn't want this to be doing something.
I want this to be as bulletproof as it can be.
Yes, yes.
I think maybe moving forward, if you guys ever did want to do a aerosolization or vaporizing other substances regulation, that could be separate from this, so it doesn't jeopardize anything you guys do in here.
Well, that's actually the point. If there's
Right.
something that somebody can strike down, do we have a severability?
Yes, we
I'm
do.
not
Yeah.
an attorney.
We do, no,
but-
we do, we always have that provision, and in this case, it
Yeah.
wouldn't even be severing this definition, it would just saying, no dice, you can't apply it to those products.
Okay.
You know, so,
Yep.
Can I say one thing about this, and this is a flying ointment a little bit about this, is what I've heard from a pulmonologist, pediatric pulmonary specialist, is this is a vaporizer and this is aerosol.
yes.
So I don't know if there's some hitch to
I'm
that as
sure there's
well.
a scientific hitch in there somewhere.
Well, and that's what I'm just wondering, I'm just saying that because you want to make this ironclad, and I just found it interesting that this is one of the opening things when I
Yeah.
had this slideshow, I found it.
I can only guess that they have both vaporization and aerosolization, so,
So we're covered.
Yeah.
I think we're covered.
Oh, it is?
Yeah,
Okay,
yeah.
Yeah, it does-
sorry.
yeah, yeah,
No,
yeah. That's all right.
I didn't mean to-
And I don't,
No, they're both.
I'm glad
Okay.
I'm just glad you're not asking me what the scientific definition is of the difference between the two, 'cause I can't
Well, I
tell you.
guess one is you're kind of heating it, and the other one is you could, like an atomizer that's used for perfume.
Okay, that helps.
There you go. Yeah.
I mean, just kind of thinking off of common examples.
Physical reaction.
So the
versus
jewel
chemical
is what, it
reaction.
is we won't go off on that, all right.
While you're changing
Yeah.
one of them, you're just kind of like creating an emulsion, if you will, an air emulsion.
Yep.
The other one is you're changing the state from a liquid to a gas.
Yes.
Okay,
All right.
Does our alcohol
From my physics
policy-
background.
We're moving on.
I just
I
look at
think
my
we'll
kids'
send that.
physics book.
Sorry about
All right, and then the next page, so the next page we're on, okay, they're trying, you see at the bottom of that page, it says identification. That goes into what's required for identification. I have many communities in the collaborative have now switched to 40, which is the first.
What does our alcohol say? For ID on alcohol? Does it have like a?
We don't have that. That's not.
No,
us.
that's actually
Oh, is
that's
that-
an ABCC regulation.
And do
Yeah.
we use a number? Should we be consistent?
We haven't.
I'm just curious.
Basically, 40 has been popular in our collaboratives, not as popular in the other collaboratives. I never understood when they raised the state raised the age to 21, or even when the individual communities raised the age to 21, they never moved to 27. I mean, you get 3 years older, okay? So people going in, you're trying to judge now 18, 19, and 20-year-olds versus. So we ended up doing this, and many of the communities in our collaborative have changed their regulations, just because I do a lot of training of the retailers, and when I do my inspections, I just say, do you think you can tell for sure that somebody is, what's the oldest, I usually say, what's the oldest you think a 20-year-old can look? And invariably, it's either in the upper 20s or into like around 30 or so. So I said, can you tell the difference between someone that's 30 and 28? No. So it's just 40 seems to be a safe, not a ridiculous, I have a store in Tewksbury they had some sales, and you want to stop by anytime. It's a mobile station on Route 133. She's a great Sherry. She's the manager there. They've been all ID, Fenway Park rule, probably almost about a year now. And it's great. It's a great store, and they're doing a great job over there. So, all right, so that's what that is. The next, let's go fast. Instead of going faster, right, there's nothing else left on that page. The next page, that's the big one. That's what the doctor was mentioning in regard to winnowing permits and such. The basic cap is that which So you wouldn't have all these provisions together. I put them all together so you can just see them together. The first one is the basic cap, but there'd be no attrition. Whereas the advanced cap, which is B, would be if a store went out of business or stopped selling the tobacco products, the number would go down by that number. So just for the sake of argument, let's say North Andover has 22 retailers, and somebody goes out of business, that number would go to 21. Your local neighbor, your neighbor Andover has that provision, so they've gone down a couple. They had, I think 14, I think now they're down to 12 or 11, I can't remember.
So this is all tobacco licenses, not just vaping?
That's right.
Not
Yeah,
just
all
vape
together.
stores.
That's right, all together. And then you're hitting the next topic, which is the dual cap. That cap is a cap within a cap. So of your establishments that sell tobacco, how many are going to become smoke shops or vape shops, or as we call them, adult-only retail tobacco stores that sell they sell the kit and caboodle, as I like to say. Anytime I go into those stores, I goes, we're checking on you, and I sometimes try to do extra checks on those establishments because they are supposed to be, I think they should be at a stricter standard because they have the jewels, literally all the jewels, the fruit medley, the mango, the creme brulee, and then the myriad of flavors that they have. The mango cigarillos, all the ones that you looked at that time. North Andover doesn't have one of those establishments. We have, the tricky thing about it is in some of the places that did not have a permit cap or this dual cap, you're finding stores want to split their store, literally split it. I mean, from the exterior, in a wall, a new door outside, and they're willing to go through that expense because of the value of these products. Now, some would argue those that argue against dual cap, meaning a cap on the tobacco and vape places, say that the marketplace will dictate how many, will saturate a town. Problem is that some towns don't want to find out how high that can be, how saturated it can be before no one else starts picking up the pieces. So Bill Ricker set up a cap of 3. Haverhill set up a cap of 4. I think I have a couple, I think I have one other one that has the cap within a cap that's just not coming to my mind. So you would have to, there's no rhyme or reason. The only argument DJ is reminding the boards of health is that this has a long-standing history with alcohol permits, except it's not like an alcohol permit, and the language is clear that you can't sell the permit. It's not a transfer. It belongs to that store and that store only. However, it does not have, and I don't know of any, the doctor might know, but I don't know of any community in Massachusetts that has an attrition that is based on the store operating. In other words, there was entertaining of that notion in Newburyport at one point. And then it's a tough one, because if you do say that somebody loses, that license goes down once you sell the store, you've devalued the store significantly for a convenience store selling to someone else that's going to be a convenience store. It's a big hit, so.
I do have a problem with this one here, but perhaps we should wait until
Yeah.
he goes through everything.
Sure.
Okay.
You had mentioned something about, caps,
Yes.
and you had mentioned kind of relationship to alcohol
Yeah.
permitting. Some towns are dry towns. Do we have to allow even one?
No, well, Winchester was an example of that. It got a lot of press and a lot of, I don't know, American flags draped around people and such like that. You can do that. I mean, the valid critique of it is, while well-intentioned, it is, and probably, I think there's nothing illegal about it. I think it tends to be just a pressure point more than anything else. I don't know it being illegal to just completely ban them. That would be I think some people view our policy for adult only, and I think that with this new litigation from Cumberland Farms, they see the vision we've always talked about. How do we get to that vision of where we don't make tobacco synonymous with convenience? That was a master stroke, to say, let's make it convenient, just like juice, milk, and bread. But it's tough to, some have proposed sunset, like you're not going to have one after 10 years, 15 years, get past maybe a a group, a set time. But the answer is Winchester, is it Winchester? I thought it was, not Winchester. I can't remember I can't remember the town, it wasn't Winchester. But there was a place that tried to get rid of all, ban it all altogether. And by the way, the criticism of that is that people just go to the next, the neighboring. It would be more as a statewide. However, that gets into the whole domino effect, if you get enough people that would do such a thing. Let me know if you're thinking of that one. That will get some real big press doing that.
We're just having a discussion.
That's right, I know, I'm just joking, I'm just joking.
You're talking about a
The
dual
next
cap at
page,
zero.
the next page, I highly recommend this provision. It is,
Essentially what it'd be,
it would
right?
prohibit
Zero.
new retailers, new tobacco retailers near schools, 500 feet. This one doesn't seem to be very controversial, once people take a breath and realize it's not for anybody that is existing. It's only for only new establishments. But it gives a little bit of peace of mind to know that a store that sells tobacco is not going to be located near an elementary or higher, middle or high school. And then the next one is, I've never seen this one adopted in any of the towns that I work with. Apparently, some may have it. I'm sorry, I don't know the answer. But it's not allowing new retailers within 500 feet of an existing retailer. So that concentration thing, they're trying to avoid. I don't have a lot of evidence on that one offhand, but if it's of interest, I put it in there. And then the last one is the required paragraph that just says that whoever is, if there's an existing business that holds a permit and then there's a sale of it, the buyer has 60 days to get their own permit. You got to move, or else they lose. So, it's an enforcement issue. I don't know, if someone was off by 61 days, no one necessarily penalize them that way, but it's basically send a message, let us know, because we want to know if this place is going out of business, or is someone, I shouldn't say, is this going to change, is the business model going to change with the new owner, or are they intending to sell tobacco? So, and then after that, the next page is just on that nicotine thing.
Question about,
Yeah.
So the one that says new retailers near existing retailers, would that kind of cover the dual cap in terms of so if you had an existing tobacco, like they were selling cigarettes and then they wanted to put the wall up, put the new door up, and then this shop next door was selling
That would stop that, yeah.
So if you had that in place, that would kind of
Yeah,
cover
you
that
get, yeah,
piece of
it's
it.
good. I never thought of it that way, but you'd achieve that through
Right.
that provision.
Right, okay.
But you'd also achieve it with a convenience store that wants to, let's say,
Right.
it's a Circle K wants to, compete with mom and pop store or something
Gotcha,
like that.
okay.
Yeah, so kind of got a mixed bag. And then the next page is, I recommend this, the free distribution language. Basically, we're having some tricky things with this, but it's good to have the language in there, and I talked to Cheryl from time to time about this. We recently had a Speedway that was selling, if you got, I think, Juuls on a card. You know how a lot of the stores have cards, and you get a discount. And it doesn't, that one's a tricky one, and we're looking into it a little more, but basically if you use the card, how sometimes you get gas cheaper because you use the whatever card. Here you would get Juuls cheaper. But we don't think it's we think it's a discount. It's not just because you use the card. There must be some arrangement with Juul. I don't know if you've heard of any of these
I
guys
heard
here.
that, but it sure sounds like a coupon to me.
Yeah, it's more like a coupon. It's a coupon hidden in a so-called credit card or discount card.
Like an
So
Irving card, you get
we're trying to keep up with this
gas
stuff.
cheaper if you have an Irving
Yeah.
card.
But this would actually prohibit what the doctor had mentioned earlier about, and I bought a couple of them with a blues that for $1. They had already a pod in there, a charger, and they were selling for $1. And that's not what the retail value is for it. So that would prevent that sort of thing. And then out-of-package sales, we added to that, your standard language is the cigarettes, as you can see the small print there under Section 9. But this new one here has, it's prohibiting the repackaging or dispensing of any tobacco product, which would include pods and cartridges like in Juul and such. I've heard, I haven't seen them, but there's some, aren't there packages of, yeah, there are packages of 2 Juuls now instead of just 4. I'm almost certain of that.
Pods?
Pods, yeah.
Pods are 4.
There's 4, but I think they're selling them by 2 as well, to make
Oh,
it
they are
cheaper.
now?
Yeah, to make it
Oh,
easier.
I
I'm almost
didn't know.
certain of that, but I just haven't gotten any. And then the next page, there's nothing. And then the next page, the violations is nothing. And the next page, 17.3, is what I mentioned way back earlier. It just says, no person shall sell or sell, electronic cigarettes except in smoking bars and retail tobacco stores. Don't worry about the smoking bars. I don't know, I kid Cheryl sometimes why they even put smoking bars in there, since you've already prohibited them on the section above it, which is 17.2. So the only place they could sell them would be retail tobacco stores, electronic cigarettes. And that's it. And I think that covers everything.
Last night when I was watching the Democratic presidential debates, and I want to be sure that I didn't fall asleep, so I read through this, and I marked it out.
What a battle. What a battle, I'm assuming. I didn't see the
And
preview.
that kept me awake till 11 o'clock.
Wow, thank you. Thank you. The summary of the rigs themselves.
And it's very good. I do have a problem, however, with 411, with the exception of 411D. And 411 is the permit capping options. I'm undecided about that, although the rest look very good. I'm undecided because I don't like to interfere with
Oh, the D in the school.
business
Yep,
and tell business what to do.
yep.
And why should some regulated establishments be allowed to sell tobacco products and other similar establishments not be allowed? So I have a problem with that. I'm not saying that I don't support it. Everything else looked terrific, but that, because it's so intrusive to business.
This is the school, this is D, right? D is in.
D is fine.
Oh, D, I'm sorry.
D is fine.
B. Oh, I'm sorry.
I don't have a problem with D, which is, you can't have such an establishment within 500 feet of the
Gotcha.
school.
Oh, the advanced
No problem with
yes.
that, but all the other ones
D
I
is in
do.
employee. Okay, yeah. Yeah, not everyone adopts that one, the advanced cap. In fact, earlier on, I mean, we had, I think it was North Reading that not only didn't do an advanced cap, but they made their cap a couple higher, than what they had, for that interest of, frankly, a business interest of allowing others to come in.
Brian, how many
I just-
establishments in North Andover
We'll come up
sell
with,
tobacco with it?
18?
Why do I should know this.
Yeah.
I'm gonna ballpark it at 20.
We talked about this last time.
Yeah, I should know it right offhand, but I
Let me
don't.
mention another thing.
I have all these.
Go ahead.
I have to say a couple things. I remember I was in, near Mendon, and a convenience store came up to me. The guy must have thought I was a priest or something, because he started giving me a confession. He said, "I'm the merchant of death. Cigarettes, sugar-sweetened drinks, these things. And I have to raise my family. But, just keep that in mind when you're looking at it bothers you or intrusive to businesses. Because the business is being intrusive to our young when we don't want them. And that's what concerns me about this kind of, the model of the convenience store, if you ask parents, when I'm at hearings, they say, frankly, I don't want convenience stores in my town. I don't want my kids getting all candy, sugar, sweetened drinks, access and exposure. The problem with the convenience store industry is they're so dependent on funding by big tobacco, they're not relooking at what their model would be more effective for them. I've been doing this since 2012, and I just feel that, I feel for these guys. They had all the interviews of the immigrants who do it, mostly Indian and Middle Eastern, and I open up sometimes when I talk at meetings, staying from Gandhi, and I've been to India, and I had a lovely talk with them. But my point is we can't be empathic so much for a business who's making a profit. I don't want to see us hurting the kids, because of a profitability issue. It's an all or nothing. I'm a pediatrician. And, this is Siegel's argument, too, about using this as a device for adults. When you read his letter, he mentions nothing about the addictive potential in teenagers, okay? Nothing in that letter mentions that. So, one other thing, and then I'll be done, is when we took the Needham data, because going to the next town, The argument is 14, 15, and 16-year-olds can't go to the next town. That's why there's a 47% reduction. They can't go to that next town. So when you hear that from convenience stores, remember the 14, 15, 16, the most vulnerable brains to nicotine, it's not simple being able to access that town by town because they can't get there.
So 18, 17?
Yeah.
What's our number?
I could look, take me a while on my database
So
system
somewhere
there.
right around 20.
Yes, yeah, yes.
Frank, are we in a position to pick and choose what we would like?
Yeah, that's
Absolutely.
your job.
This is,
Before
this
the end
is,
of this meeting?
no.
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 This
This is just
Okay.
information. This is testimony, it's
This is
information.
just for you guys to have a hard copy in
So
front of
you
you
can
to think about.
think about it, and then when we do hold a public meeting, we will discuss these things.
Yes, so I'm thinking next month, we'll open a public hearing and start the discussion.
But Ron's purposes in coming here is not to do a public hearing, it's just to say, these are what other towns have done, these are some options that you may consider that have been vetted by our public health people and our legal people, and these are advantages, disadvantages. We're not choosing among these tonight, we're just getting information.
Yeah, and this is stuff that you guys talked about at the last meeting with Ron about potential areas you guys would like to look at and incorporate into your regulation. So that's all this is. Different options for you guys to weigh and think about over the next month and discuss at the next meeting and debate, and then pick and choose and come up with your final revisions.
Hopefully
During the
by the
public
end of
hearing.
next meeting.
Right.
But open it next meeting, do the discussion.
You
then
have to
probably
do the
continue
discussion
it.
in public.
Yeah, continue it, and then at the next meeting, maybe close it and make them effective. Or if you guys want to do it in one meeting, you can do that too. As long as you open it, it's advertised, you guys discuss it in public, vote on your changes, and then close the public hearing.
I'll
Listen
start to
to,
prepare for it
listen to
tonight
any public
because the
input.
second presidential Democratic debate is on TV, so I'll be ready for next month's meeting. I'll do it all together.
Thank you, Joe, we appreciate it. If you guys want to email me, actually, I think you're going to take the lead on this now, right?
Yep.
Any questions, any opinions you guys have, email Pat, he'll have everything for the next
It's
meeting.
very
We can
good.
Discuss it.
Very
No,
good.
this is wonderful.
Yes.
Thanks, yeah, thanks for all you.
Appreciate
I would love to know what, you've mentioned some of our, and we don't have to do this now, but like it would be helpful as we think about bordering communities, just to have a sense of what, like, anybody who touches North Andover's borders, if they've made any regulations. That's just for, I'd be curious, because that is the most likely areas that people would travel to, perhaps.
Can I say something to that?
Yeah.
I'm giving a talk at the AP National Conference in October on how we got to 21. And the strategy we had to use, because you have to start with somebody, as Ron just said here, to be the domino effect. We won Boston because we did the donut effect also. We did, if you look in Greenfield area, that was a domino effect, starting in Amherst and going up. If you look in Boston, basically we went to Boston, except for Quincy, I think it was. We went, excuse me, you're surrounded, okay? What are you now going to do? You were the town that was supposed to be ahead of everybody, and the suburbs follow you. That's not happening here. We've got all our time, and that was our strategy, is to get the towns around Boston, then go say you're surrounded. So keep in mind, each town has to do their own thing to get to the point we need. So one town affects a foothold. Any foothold, there'll be an effect, with it. And that's where, this is kind of the strategy we used, and it was pretty successful.
It's exactly how it was banned in restaurants and bars and
Yeah,
things
yeah,
like that. I
makes
mean,
sense.
not everybody here has been on the board for a long period of time, but there are some of us who have been on for a while. And we're a little long in the tooth, and we kind of see that the state doesn't act until you get a critical mass. And so I understand your strategy. It's worked before. The one wrinkle is that the Juul has completely disrupted the public health establishment with regard to tobacco control, because tobacco control was largely achieved before 2016.
Did you mention something about was it in Britain that they restricted the size of the Is that a possibility?
The concentration of the pod,
And therefore, Juul was then banned because
until they
of...
produce dual pods over 20.
Oh, okay, all right,
Okay, so.
got it.
so-
I don't know.
I think we wanted to,
15.
2015.
No, there's 15 retailers.
Okay. 15 retailers, okay.
I was counting them.
Are there any,
Yeah,
are there any
you know, it's-
towns that have dual caps of 0?
Well, I don't, does Burlington?
Well,
No, Burlington does, no, I don't believe so. I don't believe so. Of 0.
Sharon did something weird, and
I
I
can-
honestly can't.
I can find that out, yeah, I can-
Sharon made me want to look at it.
Sit on it.
Because I saw something there about zero vape shop.
I know, no hissing. You understand that if there was a dual cap of 0, the word ban will fit. And we use a restriction because it can go to an establishment that will operate as a retail tobacco store. So if you, it is effectively, people are loose with that word, which I don't like. A ban is, I mean, I guess it's banned if you sell it and and you can't. It's banned from your store, I guess, so technically you could use it for that. But in terms of in the regulatory language, it's not a ban, it is a restriction, and it is a true restriction, not a fake one. It would be a fake one if it was a 0.
One on 2.4, flavor, and I'll just read part of the first
Yeah.
sentence. It says a distinguishable taste or aroma other than the taste or aroma of tobacco. And here we're talking about eliminating menthol, mint, and wintergreen. Has menthol, mint, and wintergreen been eliminated anywhere in Massachusetts?
Oh, yeah.
11 towns,
Yeah.
11 so far.
11 so far.
All those 3, plus the other ones that we have down here.
Yeah, it's Framingham, Ashland, Needham, Swampscott, oh God, Somerville.
Oh, I've got them here. Yeah, I've got them all here. But wait a minute now. We have to be sure we're not doing what we're just mentioning about ban versus restriction, or any. Brookline is a ban, right?
Yeah.
Brookline is a ban.
Yeah, well, there are 2 places, Norwood and
Norwood's a ban.
Brookline would be a ban. But the interesting thing is ban wink wink is when you do, which I just learned about the dual cap, with putting it in 21 establishments and not having any 21 establishments in your town.
But if it doesn't, now, and this, I'm gonna guess, because I don't know, but I think on the towns that it essentially bans it because they don't have a vape shop or a smoke shop, it doesn't prevent someone from converting their business to that. We had that happen in North Reading, where a convenience store was struggling because it was next to 2 very large, chain-type stores, and they just were not making it. So they said, forget it. Here's all the food. I had to go and make sure that they had to get the juices out of there and all.
I thought that's what the both of you were going to say, but I asked it because I was concerned about exposing our town to a suit.
No,
here.
we haven't had
So
any
I
problem.
wanted
Yeah,
to,
we
just
haven't-
further clarification
No,
on
that one we haven't had any problem with. I don't know of any, susceptibility to a suit for limiting the cap, just as the cap is not a problem as well. It's just one of those things that has to be a comfort
I'm not talking
zone
about the
maybe.
cap, I'm talking about the menthol, mint, and...
Oh, the
winter.
menthol mint. Is the, I'm sorry, what was your question, Joe? Is it,
What other towns in Massachusetts
and those were the
have
towns.
eliminated, and you said
Yeah.
there have been about 11 of them.
It's 13. It's 13.
It's
Yeah,
13.
Somerville, Ashland, Framingham, Barnstable, Sharon,
Okay.
Norwood, Brookline, Sherborne, Needham, Swampscott, Walpole, Harvard, and Chatham. So, and Somerville suit, the doctor had mentioned this here, there were 2 attempts to do with the preliminary injunction, to, hey, don't make them force this until we hear it on the merits. It still hasn't been heard on the merits, but it's a real good sign, just kind of like what he had mentioned, doctor had mentioned in regard to Mark Gottlieb saying that it feels good, like meaning there's a feeling of confidence. By the way, this, not that it would be favored by everyone, but if there's a nervousness or just tentativeness, you can always move your effective date too. There's one thing that felt there was some pending looming problem. But that suit, we feel, Cheryl and DJ feel really good about. They didn't get, I mean, that's a lot of loss for the store. So they usually, and this is just a really loose definition of preliminary injunctions, is you have to show that it is likely that you're going to prevail on the merits of the case, of the underlying case. And they had 2 hearings on that, one early on and one not too long ago. Matter of fact, last week, because I was in a North Reading Board of Health meeting when Cheryl, who apparently never sleeps, is texting me at 8:30, 8:45 while I was at the meeting, so I got to announce that. So yeah, they refused it.
There isn't, I'm not gonna offer this person, okay? But this person wrote a letter to Needham, well-versed in tobacco law, that they would defend if there was a suit against Needham. And I believe, might have been Sharon as well, and I'm not sure about Norwood. If I spoke to this person and they were willing to do it, because I can't offer this person to you, I just can't, it's not right for me to say that. Would it make you feel better? Pro bono?
Certainly would make us feel worse.
It's associated with an academic institution,
Right.
okay? So,
I don't think we're ready to go that far, but I mean, I think that, you know, we would be interested in hearing, especially if we get pushback from the town fathers and the selectmen board and the town manager, et cetera. I imagine we're gonna hear from them anyway. So,
well, what's interesting, what's happening in some towns is the voice, there's city councilors now that are, in fact, Newton that wants this to happen. It was Newton. And it was in Lowell too, because I think they're hearing from the schools how bad this is. And so they're actually starting to look at this and saying, we need to get rid of this right now because it's an epidemic, you know. So government is getting engaged in some towns, you know, with this, so.
well, we're engaged with the school department and with the police department, and so we're engaged with that. But I guess we're probably not at that level yet, but if we need it, now that you've told us about that, we could reach out to you if we
Please do.
needed to.
Great, thank you, Ron, I appreciate it.
You're welcome. Thanks.
Great having you again at one of our meetings.
Yeah, this is.
You guys make a good team.
Way too many. I only have 17.
I have to get your updates on things that I don't know.
Yeah, when he first came in, I thought he was your lawyer.
Black kids. I'm happy to come back for hearing. It was an hour and 36 minutes to get here.
From where?
My office.
Your dedication.
Westwood.
Westwood.
And I was
Oh.
in Lowell yesterday, and I came
Yeah.
from Mansfield, it was an hour and 20 minutes. So I have to give my schedulers plenty of notice, or I get a lot of upset parents.
Thank you
So
for coming.
Let me
Thank you.
know.
Yeah, we definitely appreciate you coming, Dr. Hartman.
Thank you.
Absolutely.
For giving me the time.
Yeah, good. Ron? Good.
We have some additional items here.
Just a couple things that I put in your packets, nothing that need to be on the agenda or announced, but I did a lot of research and talking to colleagues, the state and food specialists, such as SweetSafe, about CBD oils in food. Gummies, lollipops, around the state, restaurants and bars have been using it in their cocktails and entrees. Basically what it comes down to is CBD is not allowed to be an additive in food at this time
In Massachusetts.
in Massachusetts, correct. So this gives the explanation. Actually, what we had determined through the different channels that I worked with in terms of colleagues and professionals in this industry was that it wasn't going to be allowed, and we were going to actually have people start taking the things off of their shelves. There's a lot of issues with the Cannabis Control Commission having complete jurisdiction on anything having to do with THC and marijuana, which this is a derivative of, but it's not regulated by the Cannabis Control Commission. So it's regulated by the Department of Agriculture as a CBD product and the FDA. So there were some not miscommunication, but there was some lack of oversight and insights as to who was in charge of CBD gummies. Turns out the Cannabis Control Commission isn't, and the Department of Agriculture kind of was, but not really, because it's exempt under the Farm Bill Act. So there was some questions and some things that needed to be clarified. What it comes down to is CBD is an unapproved food additive at this time. It's an FDA. It comes from an FDA controlled substance, so therefore it can't be used as an uncontrolled substance like food.
Can it be marketed as a supplement?
Yes, it can.
So it can be marketed as a supplement, sold as a supplement, but it can't be infused into a gummy bear or something
Correct.
like that.
It cannot be sold as a food additive at this time.
So what's Ben and Jerry doing with their CBD ice cream? Can't sell it in Massachusetts then?
Can't sell it in Massachusetts.
They sell it anywhere in the United States?
I think Maine banned any CBD
Okay.
product in food.
Yeah.
The whole state.
So a lot of confusion with this one because it's kind of that gray area.
Right.
But
So if you want to create a salve that you're going to put on your skin, or an oral compound that's not a gummy bear, you can do that.
yes, so basically what it comes down to is if you're, I don't want to give anybody ideas, but if you're a store and you sell X product and you cook it, heat it up, serve it, and then the place next door sells all the other oils, tinctures, creams, rubs, you can buy both yourself and mix it as much as you want all day long. You just, as an establishment, no permitted retail establishment or licensed food establishment, can't add it to your product.
Got it.
So
And that includes drinks, so you can't put
that
it in
includes
like
drinks. Yep, coffee, pizza, gummy bears, lollipops, capsules, anything that is intended to be ingested, you can't sell retail or prepare and sell.
Okay, I think I misheard something then. So if a store opens and they want to sell CBD from hemp
Yep,
as a nutritional supplement, can they capsulate it?
they do capsulate it, and that right now we don't have an actual opinion on. I am leaning towards no, because it's intended to be eaten, and it's not an approved food additive. We don't have any places that sells capsules. We have had the gummies and the lollipops and things like that removed from stores.
Oh, okay. So how can you sell it, how can you sell CBD if you have a retail establishment?
Any of the creams, the oils,
But nothing that you can put in your mouth?
nothing that is intended or sold as a food item.
All right, so I would argue that if I take Lipitor, that's not food.
Correct, it's a pharmaceutical.
Right, so if I want to take a compounded CBD capsule, what's the difference between that? Is it a
Good question.
nutraceutical or?
Yeah, my understanding when I read it was more when it was added to food, like the gummies or the
Correct.
To
lollipops, but
cookies
like
or-
the oil, it's like it's a tincture or whatever they call it.
Yeah.
And it would be just like taking a fish oil pill. It
Right.
wouldn't
Yeah.
be
I
the
was
same
gonna say, so if it's
Yeah.
on a
So-
vitamin shelf in a pharmacy, there's not much you could do
No,
about it.
we've gotten clarification and direction that it can't be added to a food or sold in a food item. Capsules we're still waiting on. Right now, for the time being, the last few days, I said that's err on the side of caution. If we see capsules, just have not sell those yet.
Okay,
But we're waiting for an actual legal opinion, but they didn't have it in the one that just came out.
interesting.
But yeah, because it was definitely a gray area and nobody knew what to do.
Right,
So I started researching this a few weeks ago. Once that banner on Main Street popped up,
mm-hmm,
I was like, I started talking about it in-house, and then I started reaching out to food professionals and other public health professionals.
So do North Andover establishments know of this? Or
We just started reaching out this past week. The first one was the Main Street store. And then we started going around to all the other retail convenience stores and seeing who had what and talking to them about what they can and can't sell at this point. And
And
we actually brought
everybody's-
this around with us
mm-hmm,
and said, here you go. We actually
Everyone's in
have-
compliance?
Yeah,
Okay,
yep. So that was very interesting.
so this is under our purview then,
Yes, it is.
because it's an adjustable.
Yep. So with the boards of health and health departments being preempted under the Cannabis Control Commission regulations, there was definitely some confusion as to where CBD fell.
Right, so, but just, somebody wants to sell cannabis brownies where that's not our thing. But if it's CBD, it is.
Correct.
Got it.
And they can do hemp seeds, hemp seed protein, hemp seed oil.
Yes,
This is so confusing.
I know, right?
Actually, you can get that at Market Basket.
Oh. All right then.
Make it pancakes.
Yes.
Good source of protein.
Good source of fiber.
Okay. And the last thing was just an update on Baba's. I met with him after our last meeting, told him what we were gonna have him try to do. He didn't wanna really bother with it. He ordered a label machine, and he's waiting for it to come in, so he's gonna just label all of the stuff and go from there.
Perfect. Problem solved, thank you.
Very well.
All right, what is left?
A motion to adjourn.
Methinks I heard a motion to adjourn.
I second.
There is a second. Is there any discussion? Hearing none, all in favor, aye. All opposed, no. We are adjourned.